Hi, I'm Dr. Prabjot. I'm a pediatric neurologist at KIMS Cuddles, Hyderabad. So today we are going to be talking about headache in children. Headache in children is quite common. Unlike what is a usual perception that headache doesn't happen in children, it does. Again, headache can be very commonly seen during events like fever, runny nose, ear pain, and in general, whenever a child has fever, the headache can be associated. But there are other times where the headache can be present without any other intercurrent illness. So these kind of headaches are usually primary headaches, which means that we do not think that they might be associated with any brain lesions or any abnormality in the brain. So the most common pediatric headache is migraine, just like we see in adults. Commonly, what we see in migraine is that kids can have headache all over the brain rather than limited to only one side of the head as we see in adults. It can be associated with feeling of nausea or a sensation that a child wants to vomit. The child may refuse to see in the light or ask these lights to be switched off, want that no noise should be made around him, and may want to sleep off in a quiet room. So many times this headache can last for a few hours, which is okay. So migraine commonly has a lot of triggers, common ones including lack of sleep, missing meals, or change in the sleep cycle. Sometimes certain foods and drinks can trigger migraines like chocolates, nuts, especially dark chocolates, or caffeinated drinks like Coca-Cola, strong coffee, thumbs up, etc. So, the main treatment of migraine involves taking care of the acute attacks. When the child is having very bad headache, we may prescribe a few medicines to be given. And other than that, we need to identify what is triggering the migraine in a child. Now, other than migraine, whenever we have a child who comes in with a headache, we do want to check what is the blood pressure because high blood pressure can result in headache in kids. Now, there are a few red flag signs for headache, which means that whenever the child has these signs, we would request for a brain imaging or a brain scan to be done. So these signs include a headache which is so bad that it wakes up a child from sleep. A child is peacefully sleeping and then gets up because of the headache. The child has vomiting after getting up in the morning, or headache is associated with vomiting. The child is unable to sleep. The headache is in the back part of the head or the occipital region. That can be a red flag sign. Other than that, there's an acute new onset squint. The eyes are crossing each other. The child is having difficulty in walking, or the way the child is walking has changed. There's loss of balance. These all things may indicate that there is some underlying abnormality in the brain. And in such situations, we would want that the kids be brought in early and investigated early. By and large, headache is something that can be managed easily. So don't ignore headaches in a child. Many times it can be a distressing symptom, which can result in a lot of days when the child is not playing, not going to school, resulting in school absenteeism. So please bring it to the notice of your pediatrician or pediatric neurologist. And more important than that, not all kids who have headache require MRI scan or a CT scan. So it is a very, very small percentage of kids who have the red flag signs. They are going to require this testing. Mostly it can be managed or with easy measures of identifying triggers and maybe a few medications. So I hope this was helpful for a lot of parents who have kids who are having headaches. Thank you.